Hello, everyone, and welcome. I am so happy to see that we have so many international friends and colleagues here tonight. We've got people from Tokyo and India and the Philippines who I think are probably watching this in the middle of the night. So, special welcome to everyone. I'm Dr. Elizabeth Mumper. I'm a senior fellow in pediatric education at the Independent Medical Alliance. As a pediatrician with decades of experience with both clinical care and medical education, I'm really glad to be joining you for this important conversation about informed consent, vaccine choice, and the role that parents play in their children's health care. Tonight, we're talking about something that many parents encounter but are not always comfortable about talking about. And it's this: what happens when you find yourself at a pediatric visit where you've got questions or concerns or hesitations about vaccines, but you're feeling pressured to just go along with what the doctor recommends? Parents' voices matter, but far too often they feel unheard. For many families, they report to us that vaccine appointments feel rushed. They can be emotional. They can be kind of one-sided. They want more time from their doctor. They want more information. Or a lot of times they simply want the chance to ask questions. So tonight we're talking about informed consent, how to have respectful communication with your doctors, and how to help parents feel more comfortable in conversations about their children's care. Joining me tonight are Dr. Paul Thomas and DeeDee Hoover, who are co-authors of the book Vax Facts, a guide designed to help parents and guardians better understand vaccine decisions at every age and stage of life. Dr. Paul Thomas is a longtime colleague of mine. He prefers to be called Dr. Paul. He was a board certified pediatrician for 30 years. He earned his medical degree from Dartmouth Medical School and completed his pediatrics residency at the University of California. In 2008, he founded Integrated Pediatrics in Portland, Oregon, where he cared for over many, many thousands of patients with a focus on informed consent and individualized care. He's also the author of the Vaccine Friendly Plan and the co-author of the book we mentioned, Vax Facts. His published research shows work on vaccine exposure, aluminum retention, health outcomes across different vaccination patterns. He's also written about how financial incentives and vaccine programs may influence medical decision making. And today he continues to educate and coach families in pediatric health and vaccine related topics. DeeDee Hoover is a family health and wellness coach, a pediatric wellness advocate, and the other co author of Vax Facts. She spent decades supporting families and working together to improve children's health. She's also a licensed massage therapist and body worker with over 36 years of experience. And her specialties include pediatric care, oncology, pain treatment, and end of life care. Her work extends into supporting families through uh, challenges like anxiety, depression, identity challenges, and crises, especially among teenagers. Her perspective is also deeply personal. She's taken her own experience with vaccine injury and trauma and used those experiences to guide her to support and educate others. So her work is grounded in faith, resilience, and helping families move from fear to confidence. So tonight we'll talk about how parents can prepare for vaccine appointments, how to respond when they feel pressure from their provider, and how to find their voice when it matters most. So, Dr. Paul and DeeDee, welcome to our show.
Thank you, Liz. It's a pleasure to be here.
So, Dr. Paul, you spent decades in pediatric practice caring for families, and you had a very large practice. What did you see in the exam room that made you realize parents needed more support and more confidence when making vaccine decisions?
Well, go back 20, 25 years ago, and I was sitting in a huge auditorium being taught by none other than Dr. Liz Mumper. And we were waking up to what was causing this chronic health problems that we are starting to see in our children. And today, that's a big part of pediatric practice. It's neurodevelopmental issues, autism, ADD, anxiety, depression, all the whole range, and all the autoimmune, et cetera. So parents, when you come to the vaccine issue, which is the focus, I think, of the question here, it's become overwhelmingly complex and controversial and adversarial, if you will. Parents are now waking up to the fact that, safe and effective is a slogan and not, it's just one side, right? Vaccines are relatively safe. Some of them are very unsafe. Some of them are fairly effective. Some of them are virtually, well, they're less than effective, negative efficacy, if you will. So parents are waking up to this. They're getting the information where they can. Mainstream has blocked it very well. And then they go into their pediatrician. And I was such a pediatrician until I had my eyes opened, which started with the training you were giving at Feed Autism and now MAPS. I thought, as most pediatricians did, that vaccines are indeed the most important thing we can do as a pediatrician. So parents walk in, and that's what you're facing. If you are with a typical American Academy of Pediatrics pediatrician, they believe to their core. I mean, they're not bad people. Pediatricians are some of the best people on earth. I mean, look at Liz and I, we're amazing. But pediatricians are not aware of what parents are walking in with. So that's the biggest challenge, I think, as it went along. And my eyes opened in 2004, 5, 6, and 7. I'm going into an exam room for a normal 18-month or 2-year well visit, and I've got a child who is prior normal neurodevelopmental speaking, normal milestones, had regressed into non-speaking autism. And it was like, first time, oh, that's what it is. I mean, I hadn't seen it before 2004. You were in that space and already educating on it. I hadn't. And then I saw it again and again and again. It was like, okay, no more. I'd learned enough being around the trainings that you were providing and others that I was like, okay, can't keep doing business as usual. So I went in with the idea that parents get to choose. That's it. I'll provide the best information I can and let the parents decide, because there are risks to vaccines and most of those are not acknowledged.
So, DeeDee, I'm interested in your perspective on what has changed over time in the conversations between doctors and parents and the attitudes about this issue of vaccine choice.
Okay, I'm trying to figure out how to get the sun out of my face.
We are at the coast with just come a little, no.
Okay, sorry about that.
Move back.
I don't know.
Yeah, that's better.
Okay,
That's good.
I'm not going to worry about the sun. So
Yeah.
a lot has changed. My vaccine injury took place at age 5 in 1969, and again, you hear one thing right throughout. So even when I was told at 18, hey, you're free now to get vaccines, you won't have any other problems, I start vaccinating and I keep having problems and issues. I have a son, and although I was careful, and he was born in 99, so it's not the schedule that it is now, but he was affected negatively. And I had my own issues when asking, I took my son in one time because he was sick with a cold. We went to an urgent care where we were visiting, and the doctor would not see us unless I was willing to catch up my child on vaccines, although he was sick. So needless to say, I left, but I've noticed more and more that people are becoming more aware and making their own choices, but we constantly hear, who can you go to? Because not everybody's on the same page. And so now more people are questioning. And I've noticed one thing that I've really noticed that's changed ever since working with families on any health and medical decision, is there's more anxiety now around it than there used to be. I work with so many mamas that are beside themselves on, they want their child to be unvaccinated, but what if they have to go to the hospital? And what if, but my doctor pressures me, all these things. That shouldn't be that way.
It's interesting that you talk about, the doctor not wanting to do a sick visit unless you agreed to catch up the vaccines, because there was a campaign, and the little nickname for it from the American Academy of Pediatrics was grab 'em and stab 'em, believe it or not. And it was the idea that you should take every opportunity to vaccinate if a child was behind. Didn't matter if they had a high fever, didn't matter if they had an ear infection and you're getting ready to put them on antibiotics. If it was an opportunity to vaccinate, that's what the pediatricians were being taught to do by their professional academy. So you experience that, and I think many other people do also. Why do you think so many parents, though, feel that they are expected to comply with what the doctor is recommending and not really be able to have their own opinions about it or have a real conversation?
I think one is the narrative, right? It's TV media everywhere is that vaccines are safe and effective, and now with all these anti-vaxxers, you hear all the negativity towards those who really are looking at the schedule. I think that's part of it, is that it's, if you're not, help me out here, if you're not, sorry, my brain is not working. If you're not in alignment with them and they're going to push you and pressure you, then does that answer the question?
Can you pivot that question? I'll take a stab at it.
Well, I just, in many ways, parents advocate for their children, they make educational decisions, and yet it seems that when they're in a pediatrician's office, they feel like they need to just give 5 shots at once if that's what the doctor recommends.
Yeah.
And I just wonder what it is about being in that situation that makes it so difficult for parents to speak up on behalf of their children.
Yeah.
I know that. I answer it better.
Oh.
I can answer it better.
Okay.
Because we are taught that the doctor knows more than us. We're just, and this is where, in my part of the book on Vax Facts, is just a mom. I'm just a mom. I'm not a doctor. I haven't had the education. I'm not a scientist. I'm not a research reader. All I know is that vaccines are safe and effective. But then I hear this other side, right? But if I take that to my doctor, unless that person's on the same page, it's up to them, and Doc can speak to that as far as the pediatrician side goes. They're not going to survive, right? But for us as a mom, all we know is that we're supposed to be able to trust an authority to tell us what's best for our child.
I would add to that, medicine is very much like the military. It's top down. I mean, when we were in medical school, the medical student was the lowest on the totem pole, and you listened to the interns, who listened to the residents, who listened to the attendings, who listened to, the experts, the subspecialists. So, and you don't question really in that whole training process. You just like a sponge, you've got to learn it so you can pass your boards and all of this. And then you think you are the authority. I mean, as a pediatrician, boy, I thought I knew more than anybody until I realized I didn't, until I had so many parents come in with so much more information than I had, that I can't admit, at least back then, I'm able to do that now. But back then it was like, oh no, I mean, I was so confident in what I had been taught. So it all comes back to, what have we been taught? And this is true for anything in life. We have lost as a society our ability to think critically, and we need to get that back. And IMA's doing a great job of providing so much information that you can now think critically as a parent. And frankly, you're going to know more than your pediatrician, most likely anyway, on this topic. If you're locked into IMA, you're in the right space.
So, Paul, your own experience speaking publicly about vaccine risks came at a very high professional cost. And I know the whole story. It's really quite remarkable, but not everyone in our audience does. Can you briefly tell us what happened when the Oregon Medical Board asked you to prove that your vaccine-friendly schedule wasn't dangerous to kids? And how that sort of gave your life this incredible U-turn?
Sure. So starting around 2018, vaccine friendly plan came out in 2016. I was already practicing that way when I opened my new practice in 2008. So I had these, 10 years of data, but they started coming after me week after week with different bogus requests and whatever, and I had to comply. If you've ever been under the medical board and you go to your attorney and they say, well, if you don't comply, they'll just take your license. So you have all these hoops you're constantly jumping through. And the one you mentioned is, I get this letter and it says, prove that the vaccine-friendly plan is as safe as the CDC schedule. I'm thinking, how do you do that? Well, somebody gave me the wise idea, good idea, great idea of do a quality assurance program and just look at all your data. Pull every patient born into your practice and look at all health outcomes. We did it. We got all the data. We published it in the International Journal of Public Health. And that article should have shaken the whole world. I mean, that study should have been replicated in every major system because we compared unvaccinated to age-matched vaccinated. That was the only variable that was changed. Everything else in that practice of mine was the same. I mean, everybody got advice for vitamin D, breastfeeding, eating healthy, et cetera, et cetera. The only difference we were looking at there was the vaccines. And what we found was astounding. There was 3 to 5 times more neurodevelopmental issues of all types in the vaccinated compared to the unvaccinated. So ADD, ADHD, learning disabilities, et cetera. There was allergies, autoimmunity, eczema, asthma, you name it, way higher in the vaccinated compared to the unvaccinated. And then the shocker for most people, and I kind of knew it, but not to this extent, the unvaccinated rarely got sick. We're talking all the different kinds of infections, ear infections, sinus, lung, eye, skin, GI infections. I mean, yeah, some, but way less and way less severe. And that shatters the messaging we're given by the public health apparatus, which is you need to vaccinate to protect the vulnerable. You need to vaccinate to protect grandma, to protect the immunocompromised. No, who gets grandma sick? A well, happy, unvaccinated kid or a sick, vaccinated kid? Because the vaccinated kids are sick all the time. Yeah, the unvaxxed are actually providing a shield of protection. So that was the big wake up from that study. But within 3 to 5 days after it was published, they yanked my license. They had an emergency meeting, and I was a threat to public health. I got a call from my attorney, could no longer practice. I got it back for about a couple more years and ended up retiring in December 2022 when I said, here, you can have it. Now I'm free to speak the truth, and what can you do to me? Can't take my license. I already gave it to you.
Yeah, well, Paul, as you know, I admire you greatly for going through that. And ironically, at this point, there are about 11 more studies that have found exactly the same thing that you did. One of them was done with some of my patients, and we're up to either 11 or 12 now that have replicated yours. And interestingly, for our audience, one of the ones that found the same thing came from an academic center, Henry Ford Hospital in Detroit, where they, I think, were assuming that they would find that vaccinated kids were just as healthy. And they found that the unvaccinated had less chronic illness. The difference is they didn't publish their data, and you did, and you paid the price. So we admire you for that. So now that you guys know Paul's background, we're going to do something that I think is going to be really fun. We're going to do a role play. And we're going to have Dr. Thomas in the role of the pediatrician. And he's going to, not be the pediatrician that he is, right now for the world, but he's going to play a pediatrician. And then DeeDee is going to be a mother. And we're going to run through the role play twice. And I want you to pay attention to how DeeDee is different in the second role play than in the first. So, Dr. Paul, I hope you're feeling the love because the comments are coming through, people appreciating how brave you were and the sacrifices you made.
Well, thank you for all that. And
the show is on.
Buckle up. So this is going to be a 6-month well visit. And those of you who have this coming up, this might be an eye opener. If you've been to it, you know what's involved here. The current CDC schedule, we're just going to go prior to changes that were made by RFK and the new team, which have been nullified for the time being anyway. based on the CDC schedule just a year ago, the 6 months visit has now 9 or 10 vaccines. So I'm in the exam room with this new mom, and we've just finished an examination. And DeeDee, um, Riley's doing so well. She's so healthy. You've done such a great job with breastfeeding. I'm so glad you're here so we can do the most important part of our well child care, and that is to give her vaccines. And, we want to keep her healthy like she is.
Well, actually, she's not super healthy because she had a reaction to the mild to the 2 month shots, 4 months. So remember, so we were thinking we're not going to do today's shots.
Oh, my goodness. Well, I remember those reactions. Those are normal. I mean, kids will get fevers. They'll get high fevers for a couple days and even screaming for a while. It's normal.
She hasn't been the same since.
What do you mean?
Well, she's just...
Look at her. Her eyes are bright. She looks great.
Well, I've just been reading things that says when you see a reaction that you should not vaccinate anymore.
If we went with that thinking, nobody would get any vaccines. We'd go back to the dark ages. You don't want that. We don't want all these diseases to come back. You don't want her to get meningitis or whooping cough. I mean, these things can kill a baby.
I know, but I mean, I see studies and things that show that vaccines are not really safe.
Well, the vaccines have been thoroughly tested. I mean, Paul Offit has even said you can give 10,000 vaccines at once. I mean, this is no big deal. There are so many studies on vaccines. I mean, this is my life's work. I'm a pediatrician. This is what I study. Trust me, this is the most important thing you can do for her health and well-being. You want to keep her alive, don't you?
I do, but I'm scared. My gut's telling me not to do this.
Well, I understand being scared. That's a normal reaction, but you don't want her to die, do you?
No, I don't want her to die, but I also don't want her to be sick.
Well, look, take a breath, and it's going to be okay. We've got a long-standing relationship here. I'm going to take care of her. This is my job to do what's necessary to keep her healthy.
I just don't know if I can.
Should we you want to have the nurse hold the baby for you, maybe?
No.
Okay.
But do I have an option to not do it?
Well, not really. I mean, the thing is, our office has made a policy now that is so important because we want to protect everyone, not just your baby, but grandma and everybody else. So, it's the most important. Well, I mean, I can find you another practice. We have other practices in town where they're a little more casual about it, you could say. I think they're kind of reckless, honestly. We need to do this. All right.
And everything's going to be okay. It won't be worse than the other ones.
No, it should not be. I mean, vaccines are so safe. All right. So nurses normally do this, but I'm going to go ahead and we now have an RSV vaccine, which is great because RSV can put kids in the hospital at great amounts. And then we've got the hepatitis B. This is your last Hep B. So good thing we're doing that. And then we've got a DPT. That's 3-in-1, diphtheria, tetanus, pertussis. And we'll go ahead and do the meningitis ones. This is the Hib. And then this is the Prevnar for the pneumococcal disease.
None of this is going to hurt her?
No, see, she's crying, but that's normal because they're needles. That's the polio. Now they've added COVID. Thank God we're protecting babies from COVID and flu. Everybody knows how dangerous the flu can be.
No oral one this time.
Oh, we have an oral. I forgot the oral. I was going to say the polio. It's been changed. It's the rotavirus. Here you go. This is a live virus that we're putting in the mouth. And the baby will be pooping live rotavirus for a couple, 2-3 weeks, but it's okay. Sorry.
So first of all, DeeDee, I wish you could see the comments because people are loving your acting and we all feel like you were really crying. And then Paul, I love your technique of just popping the needle in and leaving it there like a voodoo doll.
Well, I wanted to make a point. This is ridiculous because for the audience, who many of you know this, the antigen that's in there is probably okay, might be okay, but it's all the other stuff that's in these vaccines, aluminum, formaldehyde, on and on, huge list. You just can't load up all those toxins in these tiny little babies. It's ridiculous. Anyway.
And the point is the informed consent. there wasn't enough, in my opinion. And it's easy to cry. I mean, I've done this skit a million times. I keep thinking I'm not going to cry at some point. But when I think about what's about to happen, and this is a fake baby, but
You've taken care of babies that were harmed. Yeah.
I've coached these mamas who've lost their babies at these visits because of the same thing that you're meant to trust, right? So I think that's it. It's real even when it's not real. And I think that's the point of it, is what we're trying to get across is that parents should be given informed consent, not be bullied, not be told this is what you have to do, any of those kind of things. So now we can do
for
it
the
right.
purposes of the skit, I would not, even back when I was a lousy pediatrician, I wouldn't have done that while a mom is crying. We would have given her some time. The nurse would have come in, calmed her down, given her the same message. Maybe you send in another doctor. I mean, the pressure is on. We're getting you to vaccinate, because otherwise we can't keep you in our clinic, because unfortunately the clinic has made that policy. And this is going on in a lot of offices. Now DeeDee's going to advocate like she would have if she wasn't playing a skit, because she now knows how to advocate. So
Okay.
round two. I'm still going to be the pediatrician who's too pushy and doesn't really know what's going on. Well, DeeDee, what a great visit. Your baby's doing so well. She's so healthy.
Excuse me. We have a little cold.
Oh, it's okay. We can give vaccines even when you have colds. It's not a problem.
Oh yeah, we're actually not going to do any vaccines.
You're not?
No, I sent a bunch of information to your office on what I've been finding, what I've been doing, and based on, my first child, Ryder, and his being so seriously injured from a vaccine, Riley was kind of an accident, if you will. And so we've decided this time to do it differently, and we're not going to do any vaccines.
Huh, but she did pretty well with the other ones.
It was Ryder that was injured. This baby's hasn't had anything.
Oh, okay. New baby. As a pediatrician, it's my responsibility to help you make good decisions for Riley so we can keep her healthy. And I know you're working on your research, and I'm glad you have. I think some of the stuff you sent might be on my desk. I haven't had a chance to get to it, but I'll certainly look through it. But I want you to know this is the most important thing we can do to keep Riley healthy and safe.
Yeah, I believe that the first time you told me with my first child, we went through all that, but now there's just so much more information. I'm surprised that you're not actually kind of on the same page with me, actually. But it doesn't matter, I guess, because informed consent is you sharing your information, and I've seen my information. So we aren't gonna vaccinate.
So you've already made that decision?
Yes.
That's unfortunate. Well, I will help you find another practice, because, our practice feels it's unethical not to do this. It is the most important thing as a pediatrician we should do. So,
how can you even think that way?
Well, the American Academy of Pediatrics, the CDC, the NIH, all the thousands of studies on vaccines over decades have shown that this has reduced infectious diseases by, it's undeniable. And we don't want this to come back and just destroy and decimate the population.
Yeah, I guess we're reading different things. I have to do what's best for my child, and I cannot harm this baby like I harmed the first one. You haven't told me any real reason why I have to vaccinate. You've just told me it's what you got to do. That's not informed consent.
Well, I'll help you find another practice if you need to have that opinion.
Okay. Thanks.
Well, she's too hard. I could blame her for probably reading books like there's that quack in Oregon who wrote Vax Facts and all that, but she would lay into me if I did that. So,
well, our audience really loved the role play. Thank you so much. That was incredibly helpful. So, DeeDee, what do you want people to know about, notice about how you responded to him in the second scenario?
Yeah, it's advocating for your child, and I call it advocating with attitude. Not a negative attitude, but attitude is just basically what we put forward, right? We hear the word attitude and we think, oh, she's cocky. No, it's the attitude that I have, that I know what's best for my child. And I've done the work and I'm not making this decision lightly. I'm seeing everything. And I think the thing is that for many parents that are out there don't know that there's any other information or any other choice. They're going to fall in. But when somebody does have doubts, they should be able to go to their doctor and have support and listen to those questions. But I've heard so many moms say, after they've talked to us, well, when I tell my doctor this, though, the doctor just tells me no. I don't understand that. I don't know. I've never been a doctor, obviously, so I don't know if there's a medical journal that says the doctor knows more than the parent and the doctor has the right to tell a parent what to do. It just seems insane to me that a doctor feels like they can tell a parent what that parent should do with their child.
Well, we have a real problem with mandates. So when you have vaccine mandates, that the informed consent is gone, right? So,
It is.
so parents are in this awkward position where they know what they, or may not know, but oftentimes you might know that you don't want to vaccinate, just like the second skit. And mandates make that very difficult. If you're in a state that doesn't have philosophical or religious, like California and New York, Maine, Connecticut, I think, and West Virginia. I might have botched one of those. All that's available is a medical exemption, and those you cannot get.
Right, but I think that's the point. And I'll ask both you and Dr. Mumper. I think that's the thing is, though, shouldn't I, as a parent, and when I work with these other moms, I mean, it should be our choice on what we do with our children, just like our own self, what we take. Curing pregnant women are forced to take all these vaccines. I don't get why that's a thing. So I tell moms and parents, make your decisions, know where you're going with it. You're not going to get informed consent from your doctor if your doctor's on that page that vaccines are safe and effective and you have to follow the CDC in order to stay in their practice. Then that's not the place for you. They're not going to be there to care for your child if something happens for your child. They're going to have made those decisions. And I personally just coach mamas to figure out what you're doing first. And in our Vax Facts book, there's a chapter on communication that I wrote, and that really walks a mama through what you do, how you go in. You never go alone, and you don't ever fear. You go in on faith. You don't fear that other doctor can control you. And when you don't have fear and you have that faith and that attitude, it's up to you. It's not up to them.
No more tears. We also coach that call first before you go in for a well visit and find out, do they allow families in their practice who choose not to vaccinate? Because if they don't, you might as well not go to that practice. I mean, if you really want to have a dialogue, you can't go to a practice that mandates the CDC schedule. There's no dialogue. It's you do this or there's the door. Well, if that's the kind of doctor you're seeing, what else are they doing that's supposedly for the greater good, right? It's insane. We need to have our doctors be partners and educators, but not enforcers of some system.
Yeah, it's the difference between having a physician who assumes an authoritarian role over you versus a physician that prefers and works within a collaborative role.
Right.
I think that's a very important distinction. So, have either of you seen how one difficult or very pressured appointment can affect either a parent's confidence in their own decision making or their attitude toward medical providers that affects them for years? I suspect that you both have.
Good.
Sawyer, yes, we have. Well, I've heard of this situation many, many times, but the main one that comes to mind that is so powerful for us, which is why we started doing this role play, was a few years back. We were speaking, and I met a mama and a dad, and the baby's name was Sawyer, and he had gone to his, can't remember if it was 4th or 6th month visit, but sick. And she's a nurse. She didn't want to vaccinate, was bullied, truly bullied into vaccinating. Same kind of situation. And Sawyer John died within 48 hours of those shots. And this has happened before, right? That the bullying has had the negative consequences. And I think that's the thing that people forget is I've heard so many people say, well, the doctor says you don't want them to get the disease because you don't want them to die from that disease. But it's back to looking at shouldn't that be the parent's choice if they want to take that risk versus all the health conditions, the autism. There's not research, but there's tests now that you can do to see if you or your child has a vulnerability to some of the ingredients in these vaccines. Those allergic reactions can cause all these things. And I think that when your doctor tells you they know more than you and you believe it and you have that kind of outcome, that's long lasting.
Yeah, there's a chapter in Vax Facts that on SIDS, and almost all SIDS happens right after vaccines. Almost none of it ever happens before. And we now know there's enough data, and we cover this in Vax Facts, that for every vaccine on the childhood schedule, you're more likely to die from the vaccine than you are from the disease.
Say that again, Paul.
For every vaccine on the childhood schedule, you are more likely to die. Your child is more likely to die from the vaccine than they are from the disease. Now, that could change someday if the disease in question is a massive outbreak in your area, then the dynamics change. So I'm not absolutely totally always against all vaccines, but for right now, where we live and in this world here in the US and in many parts of the world, actually, it's safer to have a healthy immune system by not vaccinating. You fight off not just the 14 to 18 diseases for which we have vaccines, but the hundreds and hundreds of infectious things that can harm us for which there are no vaccines. Your immune system is better able to handle those things if you're unvaccinated. I mean, COVID was a perfect example. Kids did great. I was still in practice when COVID hit. I had about, at that time, maybe 13,000 active patients and a young practice because I was having so many newborns coming in every month. Not one patient out of those 13,000 ended up in the hospital. We had parents and grandparents who died. We had a kid who went into the hospital after getting the COVID shot. He was 15 and could go to the pharmacy and get it himself, got myocarditis, almost died. Why were those kids who had never seen SARS-CoV-2 virus, why did they do fine? Well, they had seen other coronaviruses and their immune system recognized, oh, we've seen this. You're the common cold. You might be different, but we know how to deal with you. Boom, never enters the body in a way that it can harm the child. So a healthy immune system, an unvaccinated child has the most robust, healthy immune system. And that's something to celebrate and nurture and protect, which ferocious mama here in round 2 was going, And we've seen, and I know you have too, Liz, because you work with this population. First baby was vaccine harmed, injured, and parents decide no more. Second kid may have gotten a few, maybe some mild problems, and other kids after that, no vaccines. You're not going to convince a parent who's seen harm to allow the next child to be harmed. We have thousands and thousands of those stories.
And diseases. The other thing I don't understand, and I think a lot of moms feel this way, is that we're told that, you don't want to die from these diseases, but measles, chickenpox, all these things are treatable. And I think that's the thing is if our medicine is so good, if our modern medicine is so good, and if we're staying healthy and doing all the things to keep ourselves healthy, I don't feel like that fear of those diseases should be there. I feel like when you see all the harm from the vaccines, that should be something that you look and you test and you make sure it's something that's safe for you to receive.
Can I add a point about
Yeah, go ahead.
Regular pediatricians don't think that viral infections are treatable, right? We were just taught if it's bacterial, we've got an antibiotic, we're good. But if you got measles, you're at the mercy of the measles. Well, you, Dr. Mumper, and those of us who are in integrative functional medicine, we know there are so many things you can do, but your regular pediatrician might not.
And measles is such a hot button topic right now, but Paul, you and I know that measles mortality was going down dramatically to almost a flat line before the MMR vaccine ever came out.
Yep.
And that's what's so frustrating by these. It's almost like a mythology that these diseases are going to come back and kill kids because one of the statistics they'll say is that the chance of dying from measles is 1 in 10,000, but that doesn't take into account the individual patient's circumstances. So I'd be the first to admit that if there's a child in Africa who gets measles and doesn't have access to, vitamin A or clean water or proper sanitation, their risk is going to be higher than a suburban American kid. But the phrases that you were saying in the first role play just made me cringe because I know that pediatricians say that, and the data that you and I both looked at in pretty deep detail just doesn't support those narratives.
Yeah, no, it's so true. I grew up in Africa, and I'll often hear Western trained doctors will go, well, if you were in Africa, maybe you should follow the CDC schedule. But the thing is, even there, babies were dying from what you just pointed out, no clean water to drink. So they're getting dysentery and various vomiting, diarrheal illnesses without access to IV fluids. They didn't even have any medicines to support these poor babies. And yet that's what they were dying from, not necessarily from the diseases for which we have vaccines.
So, DeeDee, for parents at home that might want to sort of use your little role play to help them practice, do you have any suggestions about sort of a few stock phrases that moms can come in having kind of rehearsed ahead of time about what to say back to the doctor if they're feeling pressure?
Yeah, I think the first thing to know is there's two sets of us mamas, right? It's the mom that we've done the work, we've done the research, we know what we want. And so you can go in and you can say these things, be effective. The difficult part is for that mom that is unsure. And I think that's why I tell parents, if you're not really sure, we coach on this, how to understand every vaccine, how to go through everything, because that's the part that's most frustrating for me as a mama, is that the doctors are only telling you, like you saw in that role play, this is what you have to do. This is the only way you're going to save your baby. Can you explain? They can't explain why. They can't tell you the ingredients. They don't know any of these things. Yet they're telling me not to drink caffeine or eat fish or do that when I'm pregnant, but yet I can get 3 shots while I'm pregnant. There isn't any common sense in that to me, but for the mom that doesn't know exactly what she wants to do and is there a vaccine she should do, I feel like that research and that has to be done outside of the doctor's office. I think you have to go to the people who have risked everything, like Dr. Paul, who have seen what truly happens. Listen to them, make your own decisions. I hear parents say that they don't want to vaccinate at all, but the doc says that they kind of have to because of cold and flu season. If they have their baby, then stay home. I feel like there's just so many common sense things we can do. If you've made a choice, then it's easy for you to go in with the things that I've said. But if you haven't made a choice, don't go in again alone, and do not choose to do anything until you understand. Because I've told several mamas, if you go in and they can't say anything to you but what you just heard from Dr. Paul in that first skit, if that's what you're hearing, that's not the right place for you. If that's all that's being said, then they haven't looked, they don't know. And if they're not willing to acknowledge what has been out there and the information that is being said, if they're not going to acknowledge that, that's not the place for you. Unless you're saying and you agree, yes, if you want to vaccinate your child, that's your choice. But to let somebody else make that decision for you without giving you all the information, that's not okay.
I think if you need to buy time as a parent and you're in a town where you don't have access to anybody else, this is the only pediatric care around, and you're trying to preserve at least access to pediatric care, as long as they don't have that hardcore policy of we're kicking you out, you use I need more time to research this. I've been reading books, I've been reading articles, I've been attending seminars, and I mean, we could have a long discussion, Doc, but I know you probably don't have time. I have questions that could last an hour or two, but I need more time to think about this decision. And they don't want to spend an hour or two with you, so they'll let you have more time. So you can just stall that way. You just kick the ball down the road every time it comes up. Yeah, you're still looking into it. You're thinking about it. Who knows? You're probably going to vaccinate someday. Kick it on down the road. I mean, when we get coaching situations where maybe one parent wants to and one doesn't, the one thing we try to do at least is say, well, if you can just kick it down the road further. I mean, the longer you wait before you do anything, when you finally do something, if you do, it's much less harmful.
And you'll know if your baby hasn't reached, that's the thing we talk about vaccine eyes, when they're getting those first shots, and be at birth, when they're getting those, the baby's just not the same. You don't know for sure, like if they're crying all the time, was it the shot? Was it not the shot? If they have a reaction, was it that or not? And then the doctors then they can say, well, that's just coincidence, because nobody knows for sure. But if you've got a strong, healthy 1-year-old that's just doing absolutely great and can fight off colds and do all those things, pay attention to that. And again, understands it's your choice. What's difficult with always putting it down the road is if you're in a practice, they're not going to mess with you. I've had parents say, well, we're just going to wait. And then eventually they say yes or no. But so many people are coming around. And that's what I tell people, like Doc said, call the office ahead of time. Find out what you want in a practitioner. There's nurse practitioners. You don't have to see a pediatric MD guy that is going to push you this way, or woman, but you can pick who's going to be there. A lot of family clinics now are letting the whole family be there, and those family docs are seeing these babies. They're not forcing them to vaccinate, and they're allowing them, like if something happens, because people always say, well, what if my baby has some kind of pediatric condition? If a specialist is needed, you can get them. But it's more of, if you're raising a healthy child and your child's meeting all of their markers and doing so well, and you've made that choice not to vaccinate, that's okay. You will have to defend your position, and you will have to decide how you do that, but that's still your choice. Nobody else's.
So, Dr. Paul and DeeDee, let's talk specifically about informed consent. I know, Paul, that you've played a significant role in an organization called Physicians for Informed Consent, and informed consent has always been a cornerstone of your practice. What should true informed consent look like in a pediatric setting when people are talking about vaccines?
So 3 key elements. You need to be given the pros, the cons, and the alternatives. And what tends to not happen is the alternatives. And most pediatricians don't know the cons. All they know are the pros. So you get one of the 3. You're told these are all the benefits of vaccines. You're not told the harms, the dangers, the risks, and you're definitely not given alternatives, which one of the alternatives is to say, no, we're not going to vaccinate. So those 3 elements are key. But the other piece that is sort of critical but not appreciated, when I used to give informed consent before I myself was informed, my informed consent was pretty lousy, right? So my knowledge base on vaccine risks, all the harms, on the actual research that's out there. I mean, pediatricians don't know that vaccines are never tested with a proper placebo. They don't know that the vaccine trials are sometimes days or weeks long. They don't know that the vaccine trials don't look at all health outcomes. They don't know that the vaccine trials don't compare vaccinated to unvaccinated. And they actually don't know that the vaccines are being declared effective based on relative risk reduction, not absolute risk reduction. I mean, all that is smoke and mirrors that makes the pediatrician say, look how wonderful the research is and how safe they are. The COVID vaccine that was 95% effective, that was relative risk reduction. It was actually less than 1% effective. And that was just at reducing symptoms, mild symptoms of a cold, not death prevention, not hospitalization prevention. Think of that. We've got this wonderful vaccine for you. If Fauci came out and said, you know what, it's got slightly less than 1% chance of reducing your cold symptoms, we would all line up for it, because nobody would line up for it. So yeah, informed consent's only as good as the person providing it. And that's why you've got to plug into IMA. You got to read Vax Facts, or Aaron Series' book, Vaccines Amen, is a masterpiece. Turtles All the Way Down. There's so many great books. You've got a book that came out recently, right? That was that COVID book. If you want to really know about COVID and kids, your book's a masterpiece. You just can't listen to mainstream medicine anymore, nor the talking heads on TV. When I was trying to convince my mom not to take the COVID shot, she says, well, Paul, how can you be right and all the other doctors are wrong? And that's the problem we face. I think our whole society has bought in to the vaccine paradigm without really understanding how it was corrupted from the beginning.
Yeah, and your mom, bless her heart, she was a nurse and she was raised in the era where she believed strongly in vaccines. And I do have some empathy for people like your mom or pediatricians who believe so strongly that what they're doing with vaccines is so crucial and so important that the kind of cognitive dissonance they have to deal with when they start confronting evidence that maybe what they learned isn't exactly the case. It's can be kind of a life altering experience. And it's a very core part of the pediatric identity.
Yeah.
So thank you for laying out all those nuances. I bet there are people in our audience that didn't know all those facts, but our audience tends to be pretty Vax Facts savvy, I'll have to say.
Yeah.
So, as we're probably trying to save a little bit of time for some questions, but I do want to talk a little bit about the Vax Facts book because you guys did a really wonderful job of one of the things I wanted you to emphasize was that issue of looking at the actual risk of the disease. And I think people would be really shocked to see how actually rare it is to, for example, get a life-threatening vaccine preventable illness. So, Paul, can you talk a little bit about that?
Sure. I mean, when I coach folks, it's a 45 minutes to an hour sometimes going over with the coaching, going over each of the vaccines. But hepatitis B kills no babies who unless their birth mother has Hep B, and that's less than 1% of moms. So right there, you don't need it. Polio is gone. No wild polio since 1979 in the US and in all of the Americas since the 80s. One by one, you can go through them. And the diseases, and you can go through the vaccines and how effective, if effective they are. The total deaths from all diseases for which we have vaccines in the US per year, I think is less than 50. Okay. The total deaths from SIDS, which at least 80%, if not more, is vaccine caused deaths, is somewhere between 2,000 and 4,000. Less than 50 deaths from the diseases, 2,000 to 4,000, just SIDS. I mean, SIDS and suffocation. So it's just different scales. I mean, the problem is pediatricians can tell you a story of a kid they took care of who died or almost died from whooping cough. You got these stories of these two kids in Texas who died of, quote, died of measles. We now know from deep dive research, some from some of your IMA folks, that they didn't die from measles. Neither one of those kids. They died from complications of poorly managed measles, which is exactly what happens when unvaxxed kids end up in the hospital. They don't get good care. I don't know what it is, blinders on, but this is why you want, the audience probably knows this, but if this is new to you, make sure your provider is tuned in to real alternative integrative quality care, because your standard hospitalist follows protocols and they don't get it. They don't understand that these things can be treated and managed and dealt with.
No, and there's ways too, just bringing up the hospital care. That's a separate skit, but there's ways, and I work with a lot of mamas who've chosen their kids are not going to be vaccinated, and one had gone to the hospital and had a bad experience. So now I've coached her how to handle it further down, but it's the same thing. There's things you can say, there's ways you can be prepared. And in the ways like Doc was saying about pushing it off, there's games you can play. If you take your unvaccinated child to the hospital, you can advocate for this child. And if they say anything about vaccines, you can then step up and say, well, I'm here to take care of my child right now. Can we discuss vaccines later? And you move on. But it's definitely, it seems like we as parents have to play a game when it comes to our children's health, when it comes to the medical system. And that's where it's important, where you have your facts and understand. We talk about informed consent, but consent means that you are truly on board with whatever you're about to say to do. So if I'm going to consent to a vaccine, I should believe in it. I shouldn't do it because somebody else says to do it. That's not consent. Right?
Right.
Well, Autumn is here to, I think, bring up some questions from our very diverse audience from around the world. So, Autumn, take it away.
All right, the first one I wanted to start off with, Charles asked, Dr. Thomas or Dr. Mumper, how should we answer the herd immunity attacks?
Well, as I pointed out with an example earlier, so herd immunity is based on actual natural infection, not vaccines. And you needed, so chickenpox before vaccines, just to give you an illustration, those our age, we all had chickenpox. Our kids had chickenpox, and chickenpox would come through the community every 3, 4, 5 years. You know, it would come through, and everybody would get it. And actually, the process of everybody getting it reboosted the rest of us, right? So pediatricians never had to worry about chickenpox because they would see kids with chickenpox. Every kid you see is reboosting your immune system. But once everybody's had it, now you've got a period of 2, 3, 4, 5 years before there are enough people, but newborns, 1-year-olds, 2-year-olds, 3-year-olds, 5-year-olds, who aren't immune to reach that point where the protection of everybody else having immunity, that's the herd immunity, protects those who don't have protection. When you use it in the vaccine context, it doesn't work because vaccine efficacy wanes over time. I mean, most older adults are no longer immune to any of these diseases, or a small percentage are, but so we don't have herd immunity anyway because of the adult population. Anyway, take it away from there, Liz, and add to it.
Yeah, we've just lost that inherent boosting in our adult population. And this is a problem in a number of ways. Adults used to get boosted for chickenpox that Paul mentioned, for things like measles, mumps, and rubella. Mothers who got measles as a child were lifelong immune. It was really extraordinary. But now we've got all these moms coming to deliver their babies, and because they got the vaccine and not the disease, they're not immune to measles, mumps, and rubella, and they have the chance of passing that on to their child. So it's really kind of a dilemma once we've adopted the vaccination paradigm, and traded in that natural boosting effect, and it's kind of hard to walk that back. So it's one of the consequences of doing something that I'm sure the vaccinologists thought they were doing a good thing when they were first working on a lot of the original vaccines. I question more motives now than I did back then, but there are always unforeseen consequences, and the loss of this natural boosting is certainly one of them.
Yeah.
Another question we got, Laura Chamberlain asked, Dr. Paul, if you are able to kick the can down the road for a while, how old could your child be where the risks diminish a bit?
They diminish a bit with every year, right? You vaccinate a 1-year-old, that's way better than a 2-month-old, but you vaccinate a 2-year-old, that's way better than a 1-year-old, but a 5-year-old is way better than a 2-year-old. But no vaccines is still way better than any age. That's the really tricky part. And for starting to vaccinate, say, kids who are school age and beyond, we don't have much data that I'm aware of as to how risky it is. So that's where it gets a little tricky.
Mhm. Two questions that I'm going to combine. Susan asked, she said that she was able to decline all vaccines, but then was blocked by daycare and preschool mandates. And then Bob also asked what advice for parents who are required to have their children vaccinate in order to attend public school. What are their legal rights in this context?
So for the 45 states that still have a philosophical or a religious exemption, it is the law in your state that you are allowed this exemption. Now, private institutions have the right to make their own rules around vaccines. That's the tricky part. But public daycare or public schools cannot decline you if you're in a state that has a law that says it's your right. So you may need an attorney to just point that out to them. And once they get a letter from an attorney, they're going to back right down because the law is on your side. It's very tricky in those 5 states that don't allow it. I mean, you have to homeschool, do extra schooling that's not really school, but you can't go to regular school or daycare because your state requires it.
Renee asked, I don't know if any of you are familiar with this. She asked, wasn't there a study with the Amish community where it showed the Amish kids were healthier?
You can take that one,
It
Liz.
it wasn't so much a formal academic study, but it was an investigation by this wonderful journalist named Dan Olmsted, who I got the honor of meeting and working with. And he did a very deep dive into this and went to Pennsylvania and interviewed a whole bunch of Amish people looking for autism. And he looked at the doctors there, and the community was like, we don't see this. He finally found one case, and guess what? That one child had been adopted by the Amish community after getting a full set of vaccines. So it was a very thorough investigation. It wasn't a formally done for scientific publication study, but it definitely had merit.
Well,
go ahead. Sorry, DeeDee. Go ahead.
We see this even with our practices and stuff. When you look at unvaccinated children, it's, in my opinion, it's very clear, right? No matter what your community is, if you have a child that's unvaccinated and their sibling who's been vaccinated is so injured, that's hard not to notice that.
And I will point out, Autumn, that in Dr. Paul's practice, make sure I have this number right, Paul. Your rate of autism was 1 in 795 because you allowed, and one hypothesis would be that you allowed vaccine choice and had a number of families that chose not to vaccinate. In my practice, about 30% of patients chose not to vaccinate, and my rates were 6 times lower than the national norm for kids in my practice who had autism. And so one would argue, our detractors would argue that we haven't proven anything with that. But I feel very proud, that I probably, saved a few kids by giving that choice, because I think you and I have heard enough clinical stories about regressions after vaccines where we cannot deny in our heart of hearts that there is a connection between the child who gets either a bunch of vaccines when they were sick or a certain vaccine when they had a bunch of antecedent risk factors, or they got a vaccine and then got other triggers that filled up their bucket so that it all spilled over and it was all too much for the child to cope with. So I know the slogan is there's no connection between vaccines and autism, but that is a slogan and not something that people have actually cared for. In my case, over 600 kids with autism really believe.
Yeah. So the vaccine friendly plan that I was using in my practice for 10 years is not friendly enough. And that was what the latest data that I did showed. It was those vaccinated kids in that study were vaccine friendly plan kids. They weren't CDC kids. So the unvaxxed are just so much healthier than even a kid who gets one shot. I mean, the Hep B at birth by itself can be disastrous. By the time you get to the
And
2
in
month,
my study, I was just going to say, in my study, we counted kids as vaccinated if they only had one vaccine. And so we still showed the excess in ear infections and gastrointestinal problems and developmental delays, even counting kids with 1, 2, 3, 4 shots.
Yep. I recently had the question in a coaching session, can you get autism after age 3 or 5 if you give the MMR that age? And I had a patient join my practice. They weren't my patient when they got their vaccines, but they were following basically the vaccine-friendly plan, waited till 3 to give the MMR, and their kid regressed into severe non-speaking autism. So it can still happen even at age 3.
And we have 2 professional colleagues who are pediatricians whose children regressed after pre-kindergarten shots.
Wow.
So even though classically autism was defined as something you would diagnose, at least in retrospect, with symptoms prior to the age 3, I know 2 pediatricians who had their children regress into autism when they got their pre-kindergarten shots at age 4.5, almost 5.
Yeah. You just can't take it out once you put it in.
No.
Yeah.
Well, since we're going over on time a little bit, I'll finish up there for audience questions. But is there anything, DeeDee or Dr. Paul, that you guys would like to leave our audience with? Any closing thoughts for young moms? And then also if you could include where our audience can find you if they are interested in working with you both.
Sure. kidsfirstforever.com is our website. And I would just say there's a lot of hope, especially if you follow your intuition and follow the information that you're getting here today. And then don't allow anybody to vaccinate your child, period, especially if that's your choice.
Well, and that's the key. If whatever decision you've made, that's what should be honored by everybody, and learning how to navigate this new world of when we make a choice that differs from what other people think we should be choosing. We have to navigate that reality. We have to figure out how to keep our kids in these activities and do these things. And that's what Kids First Forever is about. The 4 in Kids First Forever refers to the physical, emotional, spiritual, and mental parts of a child. And so we coach these parents through that process of doing what's best for them and how to raise the healthiest kids they can. Understanding that if you're not going to vaccinate, there are things you can do to keep your child healthy and prevent your child from getting an illness in the first place.
I might just add that we're not anti-mainstream medicine. Okay. I'm about to coach somebody, I'm just boning up on it tomorrow, whose poor little 2-year-old is going through massive, horrendous mastoiditis, brain abscess with an organism that has nothing to do with vaccines, but they're being blamed because their child was unvaccinated. So, thank God we have mainstream medicine. They had to do surgery. It was probably life-saving. We're grateful for medicine, but let's use all the data and all the information we have to make good medical decisions and choices.
And it's the parent that should be making that final consent to whatever they do, not anyone else, in my opinion.
Dr. Mumper, any closing thoughts before I move on to our final announcements?
My friends frequently remind me that the word no is actually a complete sentence. So sometimes when parents are in with a physician and you start trying to decline an intervention, at least what happens to me is I start sort of stammering and stuttering and trying to over-explain things. But sometimes you can just smile and politely say no, no, thank you. It's kind of disarming. So that's my final thought for the day. No can be a complete sentence.
Love it.
Well, thank you for hosting tonight, Dr. Mumper, and thank you for joining DeeDee and Dr. Paul. I'm going to move on to our organizational closing announcements.
A pleasure.
Thank you.
All right. So next week, we will not have a weekly show, as we'll be in Texas for our 5th annual medical education conference, and we hope to see many of you there. It's happening April 17th through 18th, and it'll feature 2 days of sessions on emerging trends in medicine, including the latest innovations, research, and forward-thinking practices shaping the future of healthcare. The full agenda is approved for continuing medical education credits, and attendees can earn 12.75 CME credits. We'd love to welcome you there as we continue building a strong network of ethical professionals. You can get your tickets today if you'd like to join us at imahealth.org/conference. Also, we wanted to share a powerful new piece from IMA President and Chief Medical Officer Dr. Joseph Verone, titled "The Last Lesson My Mother Taught Me." In this deeply personal reflection, Dr. Verone writes about being with his mother in her final days and what that experience taught him about dignity, acceptance, and the importance of compassion at the end of life. It's a moving reminder that with some of the most important moments in medicine are not about doing more, but about honoring life with clarity, peace, and love. If you'd like to read this piece, you can scan the QR code on your screen or search geni.us/last lesson. Right now, every dollar you give will be doubled up to $250,000, and we are almost halfway to our target, thanks to the support of our donors. IMA is working to build the Parents First Project, a free, searchable childhood health resource created by independent pediatric experts to give families clear, evidence-based guidance that they can trust. In this time of chaos with ACIP, CDC, HHS, and pediatric medical associations, parents and pediatricians deserve a trusted source of information. Help us build the resources that are so needed by donating today at imahealth.org/parents. All right, well, that's all that we have for you tonight. But before we go, we wanted to share a clip from last year's annual IMA conference and hopefully inspire some of you to join us next week if you haven't gotten your tickets yet. Thank you all so much for being with us, and we hope you have a wonderful rest of your evening.
IMA is not afraid to touch those third rail topics. We're talking about alternative treatments of cancer. We're talking about holistic health. We're talking about Chinese medicine. We've got a panel just about the whole gender transition of minors, right? Who talks about that?
I know I can get access to state-of-the-art information about medicine, and I can trust the individuals that are speaking.
Healthcare professionals, don't miss this. Be part of the 5th Annual Independent Medical Alliance Medical Education Conference happening April 17th and 18th in Dallas-Fort Worth, Texas.
We are at a point in time where we can make a difference, and education is by far the most important.
It is so important to come to a conference like this because it just really restores your faith. It gives you the courage to keep going, to speak up.
Their quality of data, their quality of education, their love for people.
This year's theme, Emerging Trends in Medicine, explores the latest innovations, cutting-edge research, and forward-thinking practices shaping the future of healthcare.
Just having this Independent Medical Alliance family build, I love the humanity that comes to a conference like this because everybody has a story and everybody has something to teach.
I think conferences like this build community, an amazing forum for learning new things.
Connect with industry leaders, gain actionable insights, and be equipped for what's next in medicine. Continuing medical education credits available. Visit imahealth.org/conference to secure your spot today.